What's up, YouTube? I doing this video to show my journey and my decision to go to Aspen Dental to get a full mouth extraction and upper and lower dentures. The reason why I wanted to do this video is because of the videos that are out there that I've seen that kind of give Aspen Dental a bad rap. Some bad things that people are saying that they experienced that they had, and I wanted to just go through and let people know my experience, and to let people know that do your research, whether you go private or you have insurance or you don't have any insurance and everything's coming out of your pocket. Um, Research. There's more than enough videos out there that will let you know where to go, and you'll know the right choice when you come to it. Um, but I can't stress enough going through the research and finding out what's best for you. Keep in mind when you go through this and you finally make the decision, which is a huge life decision, to get dentures. I can tell you that I went through it. It took me forever to decide that I was going to go through with it. And the only thing that pushed me over the edge to do it was that my teeth were horrible, but I was living with it. I had no pain or anything. I had 3 teeth left at the top. I had about 4 or 5 left at the bottom teeth. And it wasn't, it was something that I did to myself. I smoked, I did chewing tobacco, I did coffee, everything possible wrong that you can do to make your teeth bad, I did. So it was nobody to blame but myself. It wasn't genetics, it wasn't anything other than I didn't take care of my teeth. And the way my decision was that pushed me over the edge to go and get it done was one morning I woke up and was going to work, and I got a breakfast biscuit at one of the local places at Burger King. And my first bite into it, 2 out of the 3 teeth that I had left at the top came out and ended up in my first bite. And that sucked. And I mean, I basically looked like the best way to describe it when I looked in the mirror after realizing that my teeth had fallen out was that the cartoon character of the baby with the one tooth sticking out. When they smile, they got that one tooth hanging. That's what I look like. And I decided, no, can't live like this. Thought it was bad before, but this is really bad. I went to work and immediately logged on to my computer, and I had decided, because I didn't have any insurance or in all the videos that I had seen and advertisement and stuff, I was going to go and try Aspen Dental. I paid out of pocket for it. I don't have insurance, dental insurance. So, which is one of the things that kept me from doing it, putting it off and putting it off. I'm not going to have enough money for it. But, I can say, if you're going to do it, do it. It's worth the investment. If you have to start saving up, then just do it. I mean, the life changes you get and the self-esteem that you get from it, just go through with it. Don't put it off. Do your research. Know what you want. Know what you can afford. And do it. Which is my name on here is no fucks, because have no fucks, just do it, live your life. The benefits of it, after being embarrassed to smile, to talk to people, it's well worth it. And it's not really for what you get. It's not really that bad money wise. Anyway, I kind of got off of the track, but basically, I logged on back to my story. I logged on Aspen Dental when I got to work that morning, and made it real simple. I mean, they go through setting up an appointment first, and you do everything online. Ask you questions and what you plan on getting, what do you want, the dates. You set up the appointment on the dates and times that they are available. Put all your information in. Once you finish that, there's also patient forms that need to be filled out on your first day that you can do online, which I suggest doing. It saves a hell of a lot of time. You can do everything online except for sign the papers, which you'll do on the first day when you go your first appointment day. When you do all of that, get everything set up, you know, the date and the time and the location that's nearest you that you want to go to. Then, you know, you hit OK and it gives you an appointment, sends you an email with your appointment day and everything like that. About what I was surprised about was about 2 hours later, I got a phone call from the Aspen Dental clinic that I was going to, from the secretary or the appointment setter and the person that works the desk. Real nice, just confirming it, thanking me for choosing Aspen Dental, just going over everything, telling me about everything, and you know, basically just thanking me for choosing Aspen Dental, which I thought was really nice. You know, the fact that they reach out to you just to confirm, to make sure you're going to show up and things like that. My first appointment day was the day available, and you can literally do the next day if an appointment is available if you want. Mine was several days because of work and stuff. I think it was 2 days that I had. I went in first day. I walked in and gave my name, and they were ready. They said okay. Asked if I had filled out the forms online. I said yes, I did. I just had to sign. She checked it, printed them out. I signed in, and she had me sit in the waiting room real quick. I mean, it's a waiting room. It's a doctor's office. And I was in there for probably about 15, 20 minutes waiting. I got, you know, once they come out, they get you to bring you into the back. The thing that I really liked, because you're already nervous about being in there. You already are worried about your decision. You don't know what's going on. You don't know what's going to happen. You're just nervous. And it's normal. But when you sit down and they're talking to you, they actually have a setup to where there's a TV right in front of you. I mean, it's sitting right in front of you. And you can watch TV the whole time. They give you a remote. You got the time, the volume, and everything, and you sit there and you can watch TV while it's downtime or what they're doing. But when you first, sit down, the assistant or the nurse talks to you, asks, what you're getting, take a look at your teeth, and they ask what your plans are, what you're there for, if you have any pain, if anything like that. And then immediately they bring you into the back to the x-ray room, and they take a full mouth x-ray of your teeth. And usually when you go to an emergency room or doctor's office and they take x-rays, it usually takes a while for the x-rays to come back. This was maybe 10 minutes that the x-rays were available and printed up, and they had them in my room so I could see what my teeth were, and she could, and this is all before you see the actual dentist. And then the nurse with another nurse, two nurses are in there, and they measure your gums and the recession of your gums. And like I said, I've always done dip, so they measured down here on how low my gums have gone. And they put it all into the computer for the dentist to come back and see. That took maybe about 15, 20 minutes. And then the dentist comes in and verifies, checks everything in your mouth, and goes over the same stuff and what you want, upper and lower dentures, what to expect, He takes a look at your x-rays, make sure you don't have any problems or anything. I did not. I got lucky, and everything was good with the teeth that I had left and the nubs that they had to take out. I ended up getting, I think it was 24 extractions, upper and lower, and both upper and lower dentures put in. I had surgery 5 days ago. February 6th was my surgery date. I actually, from the time that I'm going through my first appointment seeing the dentist, and talking to the dentist, I know I got off a subject again, but when I was talking to the dentist, he confirms everything and says, yes, we can't save any teeth. You're going to need full upper and lower. And they'll tell you if they can save some teeth and you'll get partials, or you need full extraction or whatever. They'll let you know. And then after that, he thanks you for being there again. Real nice. And then he goes to the next patient. Nurse comes in and explains, okay, now we're going to bring you out of this room and examining room and bring you to where all the billing and finance and everything is. One of the things that made me want to do this video was because a lot of people were saying that, they went in there for this, and they tried to sell them stuff and toothbrushes, and they tried to, add more money to their bill, and they tried to get more money out of them. And the thing that aggravated me with that statement is these people aren't understanding, yes, it is a service in a doctor's office, but it's also a business. It's a very large business. Aspen Dental is very large, and they're there to make money. Them advertising certain products is kind of just like on YouTube when you get monetized and they ask you to sell their products for them. Aspen Dental does that also. I was in my incident, in my thing, the lady has to go through her procedure. Every patient, they have to try to sell these products to them. I was getting a full mouth extraction. I was going to have no teeth left except for my dentures. And she still had to go through the spiel of trying to sell me the electric toothbrush. It's like a smart brush now or something, and you hook it up to the computer, and it really, if I had teeth, it'd be like pretty damn good. It measures how hard you're doing your teeth, how long you're brushing your teeth, and how often you're brushing your teeth. It all hooks up to it's Wi-Fi, so it goes into an account or something. You can log on and see, everything about brushing your teeth. Which it seemed like a very good product, and had I had teeth, I probably would have said okay. I took it as kind of funny. I'm like, well, I wish I could buy it, but I'm not going to have any teeth to brush. And she laughed and she went through it, and then she put it away, and it was nothing. I heard nothing else out there, but she did what she had to do for her job and advertise this toothbrush. And it didn't aggravate me. I don't know why it aggravates people. All you have to do is just say no, and they move on, and but let them go through their spiel. They have a job to do. And then after you get through that process and you're finished in there, they bring it back to the finance, and they explain, what teeth do you want, what dentures do you want, these are the pricing, if you have insurance or not. They go through all the pricing thing. They do have financing. I was financed for some of it, but and I'll get to how much everything was later on. But I went through that process, and once it's confirmed, then you set your date for when you want to have the extractions and the surgery done. The next available date for me to have that was about a week away. I went on a Thursday for my appointment, my first appointment. The following Thursday, February 6th, I think, yeah, it was following Thursday, I went and had my full mouth extractions, and all my teeth extracted that I had left, and upper and lower dentures put in. On the 6th, basically when I had my surgery. You get there, and then they do everything. You get checked in, you wait in the waiting room, they bring you in the back. They explained everything that was going to happen. I did not have, I was not put out. I didn't have the surgery where you're knocked out and you have an IV, and all I had was the numbing shots, which suck. Don't get me wrong, this process sucks. Um, there's not a lot of pain involved in it, like pain, like non-tolerable pain. But I would mark it as in the line of discomfort and pain. They're the fine line between those two things. But I'll have other videos explaining my journey with that. You can check out my first two videos that I have, which basically explains where I'm at and what I went through. But during my surgery, the doctor came in and numbed them up and did the shots, and it's a bunch of shots, upper and lower, outside, inside, and when you're done, your mouth is numb, your tongue is numb, you can't feel shit. You can't feel anything. You can see the blood in there with the gauze that they leave you with, but the Aspen Dental was extremely nice. They explained everything. They were caring. They greeted you when you first get there. And the pricing, they didn't try to force anything on me. Their job is to advertise what they do. If you have the money for it, they're going to try to sell you the best dentures they have. I couldn't afford it. I knew that. I knew I could afford a certain amount, and that's what I got. I got the classic, not the basic, the classic, which is the second in line. There's four types, and because of the year warranty and the things that went with it, I decided to go with the classic. And my total bill for everything that I wanted was $6,000, which is not bad. I mean, the confidence that you have, the teeth that I have, I'm going on day 5, and yeah, I've gone through some struggles and discomfort and the sores that you get. I haven't had sores, but sore spots. And then as your mouth and your jaw and your gums start shrinking after being swollen, you start having some discomfort up here where everything has shrunk. So it feels like it's too big for your mouth, which eventually you'll go and get adjustments. Periodically you go and get adjustments, and they'll adjust it. And I don't have another follow-up visit until the 21st, I believe, of this month, which is 2 weeks. Not this Friday, next Friday, I go back to it. And that's when they'll probably say, okay, they check your gums and stuff. And as far as Aspen Dental, the care that you get, I had no problems with it. They explain what they need to explain. And some people are also saying that they don't explain much and they don't give you much. They give you what you need, and they explain what you need. You have to understand that everybody's journey is going to be different. Some people you hear have a rough time. I have a very high tolerance for pain. I can't take pain medicine. I don't take any narcotics. So I've lived my life dealing with pain and have a high tolerance for it. So I was one of the lucky ones. And it was discomfort, and it wasn't a fun first, day or two. But they explain it to you. Look, you're gonna bleed. You're gonna do this. One thing that I will say though, they tell you that for about 2 or 3 hours you're gonna have to replace the gauze and you're gonna be bleeding. Well, for me, it took me 5 hours. And one thing I'm going to suggest to you, if you do decide to get them, is they're going to give you 3 prescriptions when you're done, and a little goodie bag of certain things. have somebody drive you home and have somebody drop you off, not drop you off, but drop off your prescriptions for you to get filled. I didn't I didn't do the smart thing, and I went to Walmart immediately after my surgery with a numb mouth and numb tongue, and my wife was with me, and we decided to go get the certain things that we needed at Walmart and drop off the prescriptions, wait for them. Well, what I didn't realize was that you can't feel anything in your mouth, so you don't know how much blood is actually building up. And you're in Walmart, so it's going to build up pretty quick. They give you gauze in your little goodie bag, and I put new ones before I went into Walmart, hoping that was, but that lasted 15 minutes. And I actually ended up having blood dripping all over the place on the floor. I was kind of embarrassed and ended up leaving without picking up my prescriptions anyway. So I suggest just have somebody drop them off and get them in the morning. You're not going to be doing much when you get finished. The very next day, 24 hours probably after your surgery, they're going to set up an appointment for you to come in for them to check and make sure your gums are stopped bleeding, that they are clotting good. They're going to take out your dentures and see how everything's going your first 24 hours. Again, really good experience. Caring, asked me questions. If I had any questions, answered everything I needed to, explained everything. Gave me my next appointment date because everything was going so well for me as far as the healing process. My next visit was 2 weeks from that day. But yours might be different. I've heard people go every 3 days. They go for adjustment or the checkup, or it all depends on how you're doing. And explain to them. Let them know how you feel. Ask them any questions you have. Even if you feel that they're stupid questions, this is something new to you. This is something huge. This is something you're going to have to live with the rest of your life. So don't be afraid to ask questions. They answered all of mine and gave me good answers. So, Aspen Dental, I was very pleased with. But again, like I said, do your research. Make sure you look into the dentists that are there. And remember, it's a business. They're going to try to sell you stuff. But they're there also to help. And they if you get a good crew, they care. They greet you when you go in. They explain everything. And it's really easy to get an appointment and to get everything done. I mean, from the time I made the appointment online till the time I had my surgery and had teeth in my mouth again was 1 week, and it could have been less, but it was because of my work schedule that I did that. It could have been 2-3 days had I picked those dates that were available. So just do your research, and if you aren't on private insurance and you can't go to a private doctor that might have better things for you, then this is a good way to go. They're affordable. They do have financing. They do help you out. And you can also, one of the payment things is give them a little bit down, 3 payments until you have your surgery, if you can wait that long, and have it paid off by the time that you get them and you walk out. That way you don't have to worry about that financial part of it. And all I can tell you is it's well worth it. I'm day 5, and I'm going through some issues that I'm dealing with the sore spots and things like that, and learning to eat new foods and the healing process. But I'll talk about those in other videos. But this was more about, don't be afraid to go to Aspen Dental. Just do your research about the one that's around you. If you have to go to another one, they're all over the place. I live in Louisiana, and I went to the one in Hammond, Louisiana, which is around where I live. And it was wonderful. It was great. So hopefully this helps you out. And just, like I said, do your research. And if you're having any doubts, That's it. My motto in life. No fucks. Just live your life. You're the one that has to live it every day. And, don't care about what others are thinking about you. Be happy with yourself. And this journey is going to test you. But every time you walk into the room, smile. Know you have beautiful teeth now, which is something many of us can't say for a long time. Look in the mirror. If you're feeling down, look in the mirror. Or if you're in pain, look in the mirror. Smile. Look what you have now. It is well worth it. And hopefully this helps you out as far as some of the bad publicity that